Alright, so when you come to the hoarseness, there are two types resulting due to a organic cause or a functional cause. So, what is meant by a organic cause? Which means a physiological change in um, one of the substances of the speech is known as a organic cause, such as it can be due to laryngeal anatomy, or it can be due to part of the vocal tract, or it can be due to respiration. So that is known as organic cause, whereas functional causes are result from the overuse or the abuse. So there are mainly three. It can be idiopathic, causes unknown, and it can be due to the psychological facts, and either it can be due to the vocal misusing. So when we come to the organic causes, we can divide that into two, like structural and neurogenic. So structural means specially something related to the structure of the vocal cords. If there is something like any tumor, any lesion in something like this, if there's a tumor, lesion, or a cyst, it can cause this what you call as the structural cause. If you come to neurogenic, it can be due to a problem in the CNS or peripheral nervous system. So the most common cause for the hoarseness of the voice is the laryngitis. So some other causes, we can divide it as the neoplastic or the structural causes, which include either dysplasia, which may lead to carcinoma, the cyst, polyp, nodule, or it can be carcinoma. So the first causes include the neoplastic. Then the second cause, it can be due to inflammation, such as allergy, infection, reflux. If there is a continuous reflux, it can irritate and cause the inflammation, and it can be due to smoking, the trauma, or due to voice abuse. Then there can be some neuromuscular disorders which can cause the hoarseness, such as multiple sclerosis, myasthenia gravis, Parkinsonism, and some type of nerve injuries, and spasmodic dysphonia. Then some systemic diseases, like especially the hypothyroidism and acromegaly, amyloidosis, sarcoidosis. And when you are doing the thyroidectomy, if there is any damage to the superior laryngeal nerve, or the recurrent laryngeal nerve, this can cause the hoarseness. So another technical causes include the stress, and especially the stress. So these are the causes of the hoarseness of the voice. So there is simply, you can remember it by a this simple diagram. He's Mr. Lau. So M stands for the malignancies, that is especially the neoplastic. It can be a cancer. Also you can include other causes like cyst, polyp, dysplasia, like that. Then Mr. R, that is reflux. So any causes of the inflammation like trauma, then GORD, then what you call infection, bacterial or something like that. So that is reflux. The laryngitis, the L represents the laryngitis. And overuse. So if you are overusing, like in sinus nodule, and during valve problem like mitral stenosis, and it can be due to an endocrine cause like hypothyroidism. So if you are asked, if you want to just simply remember 5 causes, you can remember Mr. Lau. So they are the causes of hoarseness of the voice.